One of the interesting things about prostate cancer is that when patients are diagnosed, we will have one set of patients who have a particular type of prostate cancer that is what we would call a low risk prostate cancer, and therefore this patient has a very good prognosis. However, there's another subset of patients who, after the initial treatment, their cancer does eventually come back. It may take 10 years, but it does recur. And what we would like to understand is, what is the biology behind this? So at an early stage, can we identify that low risk patient from the high risk patient? And so how are we going to do this? Well, one of the ways we can do this is by when men are diagnosed with prostate cancer and they come in for their treatments, we approach them and we ask them if they would like to join our study. And to do this, what the patients will agree to do is to provide us with samples of their tumours, maybe some blood tests, and then also just answer a couple of questions so that we can gain information on these people. And then we follow them up over time. And then when we actually discover which of the patients did recur, we can look back at the tumours that they had when they were first diagnosed and discover what was biologically different between these two types of tumours. And then ultimately we would hope that this will lead to us developing new treatments for those patients who are at the high risk of recurrence.
One of the frustrating things about trying to advance medical cures is the time it takes to do this work. And you often hear of a great research idea that's come out of the laboratory and some scientist somewhere is extremely excited about it, and inevitably a patient with the illness at home says, that's fine, but what does that mean for me? So one of the ways of short-circuiting that time frame is to engage in a process that we refer to as translational research. In other words, juxtaposing a very clever scientist or team of scientists with some very busy clinicians and with lots of patients in their clinics, and put those clinics together side by side with the laboratories and see if we can't help each other accelerate that mission. Here in Galway, we have exactly that opportunity. We have a very busy, very successful university with a well-recognized expertise in basic science, especially around cancer, and we have one of the busiest cancer hospitals in the country. So we have a tremendous burden in Galway in terms of dealing with prostate cancer effectively, but we have a tremendous opportunity here too.